The theme for the International Day of Persons with Disabilities 2025 is fostering disability inclusive societies for advancing social progress. We began to think about how to mark this day of reflection before it was announced, but our decision to focus on financial hardship certainly aligns with a global theme. We cannot make social progress when disabled people continue to face barriers that mean missing out. And we do miss out on so much when we're in financial hardship, as do our whānau and communities when barriers prevent us from connecting. We know disabled people are diverse, and we can sometimes get tired of hearing how badly off we are rather than how much we contribute or when many are doing well. But it is really important that we do know who isn't doing well and what things are driving that. And the statistics show that some disabled people, including some whānau Māori and Pacifica, are in real difficulty, and we need to see action from decision makers to change that. Today we'll be referring to the term material hardship, which simply means not having enough money for everyday things and having to do without. Doing without or worrying about making ends meet has a huge effect on our lives, our health, whether we can join in and whether we can contribute to and be part of the things that are important to us. So we commend MSD for commissioning research in 2023 to try and understand more about what is leading to the higher rate of material hardship and severe material hardship for children living in households with a disabled person. That covers households either with a disabled child or children and children living in a house with disabled adults or adults. Of course, it can be both. The research had a number of strands. Two strands focused on diving into a lot of data to see what extra detail about contributing factors could be found, and three strands with small numbers of people and deeper conversations to better understand people's day-to-day experiences, such as costs of disability and knowledge and experiences with wins, including specific experiences for whānau Māori and Pacifica. Our aim today in our relatively short time is to give you an accessible introduction to the research findings, which you can explore in depth over time. All of the reports are linked in the evaluation form you'll receive after our session, and you may have seen them as part of the registration. But just to run through those strands that our panelists will speak to, firstly, the report looking at all the data we have to understand more about the rates of material hardship amongst disabled people, including who in particular is experiencing it. Next, and also using a lot of data to calculate or estimate how much more income we would need just for households with disabled people to have equal rates of hardship with non-disabled people. Not to overcome the hardship, but just to draw even with non-disabled people experiencing hardship. Then we move into the qualitative strands based on in-depth conversations. What people's experiences of work and income were and some of the costs of disability, specific experiences for Māori, as well as specific experiences for Pacifica. Unfortunately, because of other commitments, we don't have any speakers from the Pacifica strand today, but Pacific's families shared many similar strengths and hardships with our Māori whānau, and we'll summarise this strand after we've heard from panellists. We're so thrilled to have such skilled and passionate speakers with us today. We have Moira Wilson, who undertook the research in her former role working as a senior analyst at the Ministry of Social Development. She's currently in her first year of studying for a doctorate in the School of Social Sciences and Public Policy at Auckland University of Technology. Dr. Jonathan Godfrey is a senior lecturer in statistics at Massey University's Palmerston North campus. He is also president of Blind Citizens New Zealand. Jonathan places a lot of value on high quality research and is often advocating for the rights of disabled people. Jonathan was both a researcher and a member of the overarching research program advisory group. Dr. Rebecca Gray is a senior consultant at Allen and Clark. Rebecca is a social researcher with a PhD in public health. She's worked in research and evaluation in academic, government, non-government, and private sector roles. Much of her work has focused on initiatives to promote health and social well-being. Helena Tuteao is a policy analyst and advisor with experience working in government and social service settings. Helena is on the Waikato Leadership Group of Enabling Good Lives and is one of the authors of the research for MSD. Helena believes all disabled people in whānau need to be making and influencing decisions at all levels and directing the supports received. Dr. Fiona Cram, NZOM, and of Ngāti Pahauera, is a pioneering social scientist whose research strengths are well-being and self-determination. Her career spans decades of work in health, education, and social services with a strong focus on empowering communities through evidence and action. She's the founder of Katoa Limited, supporting research that transforms policy and practice across Aotearoa. So let's get into the panel, and I will just wait for our panelists to be spotlighted as well. Our first question to each panelist is, what are the main findings of your strand and research? So, Moira, I want to put that to you and give you the difficult task of telling us in 2 to 3 minutes what the main findings of the research are to understand the real magnitude of material hardship amongst disabled people.
Tēnā koutou katoa. Thanks, Prudence, for that fabulous introduction. I'd like to just quickly acknowledge the many people who helped with this strand of the research. Keith McLeod can't be here today, but was central to the work and to the strand that Jonathan will talk about. And we had great help from colleagues at MSD, Waikaha, Stats New Zealand, and across government, and from the expert reference group. I'm really grateful to those at MSD who worked so hard to get the work program to completion and out the door, and especially to the disabled people and their families and whānau and ainga who shared their experiences through the qualitative strands, and to the research teams who brought such commitment and insight to bringing those voices forward. I need, to also note that the results that Jonathan and I will talk about are not official statistics. They're our work, and the opinions expressed are ours, not those of Stats New Zealand or MSD. And access to the data we used was provided by Stats NZ under conditions designed to give effect to the security and confidentiality provisions of the Data and Statistics Act 2022. So I thought it would be useful to talk both about some of the things that we knew going into this strand of the research, as well as some of the significant things we found out. When we started the work, Stats New Zealand had been reporting child poverty statistics for children living in households with a disabled person for 3 years. We combined the data from all those 3 years so that we could build a better understanding of what the data was showing to inform possible policy responses. So we knew from the Stats New Zealand reporting that children living in households where there's a disabled person account for over half of all children in material hardship. What we found out was that these children are even more overrepresented among those in the most severe hardship. We knew from Stats New Zealand reporting that overall Māori and Pacific children also have high rates of material hardship compared to other children. What we found out that was these hardship disparities are also present within the population of children in households with a disabled person. We knew from MSD's child poverty reporting that rates of hardship are very high in households where no adult is in paid employment. What we found out was that even among children in households where adults are in paid employment, being in a household with a disabled person substantially increases the risk of hardship. And we knew from SATS New Zealand reporting that overrepresentation in income-based poverty measures is not as marked as the overrepresentation in material hardship. What we found was that average household incomes of children in households with a disabled person, although lower, are fairly close to those of other children. And this is telling us that other factors, in addition to lower incomes, are contributing to the high rates of hardship. Additional costs associated with disability are likely to be a really important factor, and these costs reduce the amount of income people are able to spend on other essential items. So it was that finding that motivated the study that Jonathan will talk about. And so shall I hand over to you now, Jonathan?
Sure. Um, I really appreciate the opportunity to join the reference group that MSD put together. And it was through the work that I was then exposed to that the opportunity to do more with data we could extract from the integrated data infrastructure started to become evident. So having that rich conversation following on from what Moira has just talked about, led us to pose the question, well, what if we could change the income for households with disabled people, and try and make the likelihood that they would be in material hardship equivalent to households where there were no disabled people present. And I think the real magic of this story is actually how much data there is in the IDI now. If people want to get it and make use of it. And so my major message is we've now proven that the IDI, the integrated data infrastructure, is a rich source of information to understand the experiences of disabled people or the households they live in a way that means we can evaluate what policy changes need to be made. I think people would expect that if your income rises, the likelihood of getting into trouble financially, as measured by material hardship or even severe material hardship, should be decreasing. And at some point, you would say it should be equivalent to households with no disabled people in them. There's always a risk that any household will find themselves in trouble financially. But it shouldn't be because there are disabled people living in a household. And that's what we've been able to discover. And we've been able to discover that just raising the level of income for a household is not a magic bullet for reducing the probability that a household will find itself experiencing financial hardship. And I think that that's major, and I would expect most people would think it's somewhat disappointing. Even if we looked at your average household, the median, the middle point, the middle New Zealand household, and you compare a household with a disabled person from that median level of income to a household that doesn't have a disabled person, there is still a significant gap between those two households, everything else being equal. And so something's going wrong for those households with disabled people that we can't put our finger on using this research. We know that the likelihood they'll get into trouble is greater. We can't really prove what it is that's causing it. So the major message I would say for today that I would want to impart is that more agencies and actually more organisations outside of government who need the evidence to support their advocacy work, that you need to be talking to professionals who know what the IDI can do for you and your organisation and the issues you wish to push. We do have professionals who can extort quite a lot from the IDI. It is government's own data. It's what they collected. So it's a very powerful tool for those of us outside of government to use to effect change. Thank you.
Rebecca, in commissioning your strand of the research, MSD perhaps made informed deductions about what could be contributing to the levels of hardship. And your research focused on some of those extra costs of disability and whether people knew about or were accessing any disability related income supports available.
Yeah.
I'll now hand to you to speak to those.
Kia ora. Thanks, Prudence. So this, I was a co-lead of this. I was with the Allen and Clark team, and I co-led this piece of research with Grace Stratton and her team at All is for All, who were really awesome disability lived experience specialists. So that was great. So shout out to those teams as well. So when we spoke to people about what were the extra costs in their household specific to health and disability, they could identify things like, healthcare treatments, equipment. I think notably, over half of the people we spoke with, of the 35 we spoke with, had extra costs related to transport as well. Food shopping was tricky because a lot of households did have specific nutrition needs. But it was also the area often economised on because people just had so many other non-negotiable payments that took up their budget. Overall, though, people often found the extra costs quite hard to estimate because by the time we spoke to them, they'd already figured out a lot of compromises, a lot of adaptations. And the cost of living was going up so quickly at that point that it was like, well, what's health related and what's just the cost, or what's just the cost of having children versus the cost of having children, one of whom has extra needs. So it was quite hard to separate that out sometimes. When we asked people if they had enough, a lot of people who said, we've got just enough, so that was kind of their survey question answer, would then elaborate that that meant they were getting by this week, but if anything unexpected happened next week, they could be in trouble. So just enough was actually quite precarious. In terms of the income support system experiences, we did find a quite concerning indication that people's ability to navigate some of those systems to make sure that they were sure that they had their full entitlements, the ability was unequal. And what that meant was that possibly those with lower access needs and more ability or capacity to advocate were likely to have an easier time. And participants were concerned about this, and they were often quite self-aware, like they knew how they came across. They would time calls when they were feeling as well as possible because they knew if they were tired or upset, it would go worse. They might not get what they wanted. Some people knew they could be perceived as difficult, and if that meant they got treated as difficult, then it would compound all those frustrations they had towards various systems. Those who knew that they could come across as articulate and well-informed were quite aware this had helped their case, and they were quite conscious that there were others who might have had a harder time than them. So those were sort of the overall things I wanted to talk about today.
Thanks for that, Rebecca. Helena and Fiona, we've heard from Rebecca. People find it really hard to identify which of their costs are directly disability costs, but can you tell us about what whānau shared with you about costs of disability and whether they knew about or accessed any of the income support available in relation to those?
Kia ora, Prudence. Tēnā koutou katoa. And I wanted to firstly acknowledge those who so generously took part in the research, sharing their lived experiences. And also I just wanted to acknowledge Fiona Cram too, who's here today and was the lead researcher. And so in our part of the research, the most significant findings were centered on the real, everyday financial pressures facing tangata whaikaha Māori and their whānau. And what became really clear pretty quickly was that simply life costs more when the world isn't designed with disabled people in mind. And so participants spoke really openly about the constant trade-offs they had to make. And these were things like choosing whether to spend money on personal care or on transport, or on staying connected to their whānau and wider community. And so these weren't optional extras. These were basic needs competing against each other in really tough ways. And so one of the big things for us was for tangata whaikaha Māori not being able to go home to connect with whānau, whakapapa and whenua. So connecting with their marae, visiting the urupa. They couldn't afford to travel, and this shouldn't be an add-on. Housing was one of the strongest themes. Most of the people we interviewed were renting, and this took up a huge part of their budget. And so on top of that, many were living in homes that weren't accessible. Narrow doorways, steps, and bathrooms that didn't work for people's mobility needs. And so when landlords weren't willing to make modifications, that pushed people into even more difficult financial situations. Neighbourhoods also played a big role. Some talked about feeling unsafe, being far away from essential services, or being isolated. Loneliness was a common experience, especially for those who struggled to get out and about. When we looked at income support, many had good knowledge of what was available, often because an advocate had helped them. But their experiences with work and income ranged from quite positive to very frustrating. And interestingly, most people declined the income support check. And so some reasons for this included not trusting the process, not having time, or feeling certain nothing would change for them. And so that lack of trust in the system was an important and interesting finding within itself. But despite all of these challenges, what really stood out was the generosity, the honesty, and resilience of the participants. They shared their stories, not just for themselves, but also to improve the systems for others. And so their voices highlight the needs for systems that are more responsive, more culturally grounded, and more aligned with te tiriti, and also having a good life. Ngā mihi.
Kia ora, Helena. And of course, we know researchers are generally very careful about what conclusions we can draw from research, and don't want to make casual connections. But the purpose of the research program was to help inform policy work. So I want to put another question to panelists, and that is, what are the policy implications for the findings? And so maybe each of you can tell us one or two areas of policy direction from the findings you were involved to, or that they might point to. So we will stick with you, Helena and Fiona, and put that question to you. What are the policy implications for your findings?
Kia ora anō tātou. And so our research clearly points to several policy and practice changes that could make a real difference on people's lives for tangata whaikaha Māori and their whānau. And so firstly, housing needs some urgent attention. People were spending so much of their income on rent, and many of those homes weren't accessible. We need policy that supports accessible housing and ensures reasonable modifications are allowed, and prioritises disabled Māori in public housing. Public housing policy would relieve pressure on almost every area of life. We also found several gaps in essential financial support, such as dental care, insurance, respite, and the ability to plan for emergencies. Participants talked about not having enough for dental treatment, needing more flexibility in personal care budgets, and not being able to access basic insurance. And so we believe that policy needs to reflect that. Also, there is a lack of financial resources to enable people to work well, because we know that not everyone's pathway to accessing financial resources is through employment. And so many participants didn't want an entitlement check because of past negative experiences, or because the system felt really overwhelming. And so a kaupapa Māori approach, which is built on relationships, respect, whānau involvement, and lived experience, we think would rebuild trust and create better outcomes. And I think lastly, another shift is embedding te tiriti or waitangi across income support settings. Disabled Māori often experienced what we called, or what we described as, a double whammy. And so that means the combined impact of disability and also systemic inequities. And so policy does need to uphold tino rangatiratanga, honour Māori leadership, and also recognise the long-term impacts of colonisation on economic participation. And finally, we need more investment in social and whānau connection. People told us that connection was vital to their wellbeing. That means funding things like accessible transport, respite care, and community-based programs led by Māori and disabled people. And so we need systems that are flexible, relational, and culturally grounded, and genuinely designed to support people to live good lives. Ngā mihi nui.
Kia ora. Thank you for that, Helena. Um, Rebecca, what are the policy implications for your findings?
Thanks. Yeah, it's nice to come after Helena because I can just kind of go, yeah, what she said. But yeah, I mean, like their project, we also were asked to offer people an opportunity to get their entitlements reviewed by Work and Income, and the majority said no for similar reasons. I think a practice issue rather than policy perhaps is just that kind of long-term need to embed within Work and Income, or within MSD, should I say, the expectation that people will be treated consistently by their case managers, so they will be assessed consistently, because most people we spoke to didn't think that that was happening. And to be fair, some of them had fantastic case managers, named them, loved them, but they were quite aware they felt lucky because they were like, oh, it could have been someone else. So we don't want people to have that feeling. So that's kind of a long-term, perhaps even a bit of an image issue. But I mean, it is important, I think, just to make sure that those systems are being well embedded and that people know about it. But the other thing I wanted to raise was about paid work, because a lot of the people, the costs they were describing were actually opportunity costs. The things they had to compromise on that meant that they couldn't participate in their community as much, in their family as much, or in paid work as much. And part of that was because the opportunities available to them for paid work didn't line up with their capacity, either timing or, resource energy wise. We have this expectation that being ready for the workforce means that you're available 40 hours a week every week and you never get sick and you're never away and otherwise it's inconvenient. And we know that's not true. We know that's not true for lots of people. But in a number of cases where we were talking to in this research, people's conditions fluctuated a bit in severity. So like one week they'd be available for 20 hours, but the next week not so many because they just weren't up for it. They weren't well enough. So I think anything we can do to make flexible part-time work more feasible for people. And I think this has actually been noted in the disability strategy, which just came out like yesterday, that workplaces don't always understand disability inclusion. They might not be aware of how to provide accommodations or the kind of tools available to help with hiring in disabled workers. So making it easier for the employers and the employees to participate in the paid workforce more flexibly would be fantastic. I don't want to overshoot my brief and get in trouble, but I have seen people discussing things like the supported living payment, and the fact that some of the people we spoke to, so it resonated, said, an opportunity came in, but I had to calculate if I'd lose my benefit entitlement, and then it would literally not be worth it financially to me to do the paid work. Like, we don't want people in those situations. We need their baseline covered, and then if they can do extra, great. So that's maybe one direction to look to. There are others, but yeah, that's what I would say.
Kia ora. Thank you, Rebecca. Jonathan, how about you? What are the policy implications for your findings?
So because we were looking at numbers in a machine, not talking with people directly, we can only talk in broad brush, across the population, we think, type levels. But clearly any policy that mitigates the cost of disability is going to reduce the likelihood of getting into financial trouble. I would echo the sentiments to do with the welfare trap, or the poverty trap, if you want to call it, that are a consequence of the abatement rates and those decisions that people make quite logically. It's not worth working 25 hours a week because it'll kill me physically, etc., and I won't benefit enough financially to bother. That's got to be investigated more thoroughly before we keep hearing go and get a job type talk. I believe one of the most dire areas where government could do more relates to the disability allowance structure. When they have a list of recognised costs that they say as government, these are valid costs of disability, and then they turn around and subsidise half of that cost up to a cap, they are in fact, or should at least be really thinking about this, they are in fact contributing to the problem that we've already addressed today. How do I cover my costs of disability that are necessary if I'm not fully covered by government for them? What do? I spend the money out of my base benefit. That's the logical thing to do if you are a household that has someone in need. You make horrible decisions that many of us don't want our peers to be making. So I think things that can happen very quickly, Prudence, if only government wanted to do it. And I would say government of every flavour for decades has kicked this problem down the road. We have seen some changes in disability allowance criteria with respect to what costs are allowable. But while we keep saying these are valid costs of disability, but we won't cover the expenditure in full, government is actually part of the problem. That'll do for me for now.
Kia ora. Thank you, Jonathan, for that. Moira, what are the policy implications for your findings?
Yes, they really echo what's already been said. So the overall message from our findings is that more financial resources or in-kind supports for households with disabled people are needed if we're to address the disparities we see in the rates of hardship for the children in those households. One of the key things that we found was that for most children in households with a disabled person, there is no receipt of disability-related income support payments in the household. Something that would be really useful, as Jonathan says, is a really good look at the disability allowance to increase the level of support it provides and to shift eligibility up the income distribution, as we know that the hardship penalty is not just confined to those on low incomes. It would be helpful, as well, as everyone's said, to make the whole process less complicated and burdensome for disabled people to access and maintain their entitlements. And awareness is a problem. We know from other newly released MSD research that around 30% of low and middle income people are not aware of the disability allowance, with Pacific people among the most likely to be unaware. An overhaul would take time, but there's quite a lot that could be done in the meantime with current policy settings to make sure that everyone who needs it is aware of and able to access the support that they qualify for under current policy settings. MSD's been very effective in the past using community-based outreach to increase receipt of payments. In the 1990s, MSD introduced childcare coordinators who worked with early childhood providers to raise parents' awareness of the childcare subsidy and to support them to go through what's quite a complicated and burdensome application process, but to do that and to maintain their entitlements, and that was very successful. More recently, MSD's funded community connectors from the community, and that successfully helped people access supports during the COVID-19 pandemic, including people who were reluctant to engage with government services. So these are initiatives that have in the past been effective in boosting receipt of the supports that are there. I think we do need a big overhaul of disability allowance, but there's some stuff that could be done to get proactive, culturally responsive, community-based outreach out into the community as a way of boosting the receipt of the incomes of people in low-income households now.
Kia ora. Thank you for that. For our final question to the panel, we wanted to invite them to take off their research hats and just respond from their personal perspective. So, for example, sharing what stood out and has stayed with them from the research, or perhaps if they have, if the minister had been able to join us, is there anything they would have hoped to have heard from the minister, or questions they had? So perhaps if each of you could just share one thing from that in a personal capacity. Maybe let's start with you, Rebecca.
Sorry, I was just trying to multitask and type a response. That was great. Yeah, one thing that struck me. We did talk a bit about ableism or disableism when we were writing this up. You know, that sense that there's assumption that people with certain characteristics are perhaps treated as less valuable, or that their needs are a lower priority. I did feel the way that a lot of people talked about their experiences. They started on a slightly defensive thing of saying, look, I'm sure there are people who are trying to rip off the system, but we actually genuinely need this. Like, absolutely. Like, there was this sort of like this assumption that they'd be seen as trying to take advantage. There was this feeling that they had to express gratitude for barely getting their basics met, or just accepting that their opportunities were limited. I felt like the psychological burden of some of those opportunity costs that were caused by low income because of their situation was, I think, quite difficult. Like, and what I'm talking about here is people being in that sort of loop situation of not being able to work enough to earn enough money to get all the things that they needed, which would help them achieve better health and better access, which, if they had those things, could then allow them to feel well enough to work more, to get more money in order to afford the things. But they couldn't quite get that financial or resource boost. Maybe they didn't qualify for the subsidies or particular allowances, or maybe they just couldn't afford them. And, you know, sometimes they could even see there's a better medication out there, there's a better flat down the road, but I just can't get it. So that's really tough, I think, being able to see that there are things you might get, but you just can't quite.
Thanks for that, Rebecca. Moira, how about for you? One thing that's perhaps stayed with you, or you might have hoped to hear from the minister.
I guess I find it hard to take my researcher hat off. I was just really grateful with this research that we were able to combine the quantitative and the qualitative, and bring together the voices and the numbers. And I hope that makes a difference in some way.
Kia ora. Thank you for that. Jonathan, how about you?
I was going to talk about the disability allowance, but we've talked about that enough and given you the solutions to as the take-home messages, hopefully. But a simplification of the systems would see the removal of anything relating to income in the eligibility criteria across all systems support as a basic principle. And I look forward to the day that we do see a minister respond directly to research like this, because we haven't had it before. We haven't had the evidence. We haven't had the proof to put on the table and say, well, now, Minister, what do you say, given the evidence that is before you? It's not just us telling stories anymore. You can't excuse this away by it's just a handful of disabled people anymore. So the anecdotes and the personal experiences are really, really valuable. But now that we know the magnitude of the problem and we can demonstrate the magnitude of the problem, it's time we saw a ministerial response to the problem.
So one of the things that really struck us, and I'll be short so I can give Fee an opportunity, is the emotional and the cultural load that tangata whaikaha Māori are constantly carrying, having to make constant trade-offs of, trading, between emergency dental appointments versus good nutrition versus paying the power, and also trade-offs with connecting with whānau, with whakapapa, and with whenua, and to be able to participate and to engage in tikanga on their terms. Kia ora.
Kia ora. Thank you.
Over to you,
Kia ora. I just think too, I'm so grateful to have been involved in this research with my colleagues, and Helena, it's wonderful to have you here. I think you've said everything I had written down to say, but I just want to riff off what Jonathan said. Often when we go out to the field and we invite people to participate in our research projects, and this was no exception, we speak to them about our long-term relationships with people in government departments and the commitment of those people to using evidence to inform policy changes. So we try and hold people within that relational context and assure them that when they tell us stuff, we're reasonably confident that it informs policy. And so I think this was the joy of this bit of research at the time it was done. And so we sat around people's dining tables, and they were so generous with us in terms of sharing about their lives, their challenges, their joys, their aspirations. What it really brought to mind for me was, why don't government agencies work in this relational context? Rather than being punitive, as has been pointed out by Rebecca, or people feeling like they've been punished or they should be unduly grateful. Actually, this understanding of people's lives and how they can be supported is just really good case management. It's about a duty to care, which should be embodied in people's professional practice. And if they can't personally care, they should pretend at least they professionally care, because we saw examples of really good case management, so we know it's not impossible. And my last thing, I just want to add that being financially strapped shouldn't be isolating. It shouldn't make people's worlds small, because as Helena's pointed out and others have pointed out, connectedness is our lifeblood. And cultural connectedness is a right, not, optional add-on. Kia ora.
Kia ora. Thank you for that. Before we move into questions from the audience, I want to provide a brief summary of the experiences of Pacifica families that were included in the report. And so they were experiencing higher levels of hardship as a whole community, which has increased, of course, for households with disabled people in them. Generally having a lower awareness and therefore uptake of available supports. And highly valuing and relying on family, community, church, and faith in supporting disabled family members. However, many disabled people in their aigo often went without or made do, but it was also family members who provided care, support, and advocacy, which helped people manage, compensate for, and share costs. So as I said earlier, unfortunately, some of the researchers from the Pacific Strand couldn't be here today, but I wanted to share those with you. As I also mentioned earlier, though the Minister is not able to join us, we will still take any questions that you've put in that are relevant for the Minister and send those through to the Minister's office for response. So now to your questions, and we have a few coming in. Thank you for those. So first of all, this research was commissioned a couple of years ago. Do the panelists have a sense of whether things will have changed for the better or worse since then. So you may be cautious, I suppose, to assume whether that's the case. But do you have a sense of that? Moira, you look like you've got your
Or just looking at the child poverty trends, things have either sort of leveled out or slid a bit backwards since the period covered by our research. So I'm afraid there hasn't been improvement since then.
That is concerning. Jonathan, did you have something to add?
Every single year, new data gets added to the IDI. So we can go and track how this is trending because there's a household economic survey going on all the time. So we can go and do it again and again and again. And if an interested minister wants to know, they'll know. But if they don't ask, it's because they don't want to know.
Mm-hmm. Thank you for that. Helena, did you have anything to add?
No, not anything that's hasn't already been said.
Great, thank you. We might move on then to the second question that we have. And that is, what are the panel's thoughts around introducing a universal basic income to alleviate the dilemma around meeting competing basic needs? have any volunteers on that question. Rebecca.
Again, I am not meant to be representing any particular policy views, but I will say that this just does back up some of what I raised earlier about people needing the basics guaranteed to be covered if they can then use that as a springboard to do more, to earn more. So some people would call it the UBI. It depends on who you're talking to, but I can see the argument for it.
Thank you. Any other thoughts from the panelists about that question?
Yeah, Jonathan here. Look, I think the idea of basic universal basic income has definite merit, but it's not going to change the problem that relate to specific costs of disability necessarily. If you change what you are doing in life, your costs of disability will change. And we have numerous targeted systems at the moment to support the costs of disability, but they are not adequate. So whether a UBI would meet the needs to cover the inadequacies is a bit of a guessing game. It might become a bit of a social experiment. Perhaps more targeted options offer as much hope or promise. Both isn't a bad idea.
Thank you, Jonathan. That's a good point, that many different approaches are often needed. Our third question for the panelists is, did the research identify changes to improve complex forms if applying for government assistance? And the person just comments, I may be eligible for a community services card, but the 16-page form is too difficult to complete with information I can't easily provide. Any comments on that question or responses to that?
I think the people we spoke to would agree with you. And I think I've only just read it quickly because it just came out, but I think there is something in the framing of the new disability strategy about making the administration easier for people. So we'll see what happens.
Yeah, of course, forms and everything. It really is information, which of course is a right for us to have information in the ways that we can receive. Okay, the next question is, we know disabled people also experience higher rates of violence. Did any of the research identify costs relating to family violence or intimate partner violence and or child-to-parent violence and abuse, and how these costs could be covered? Is that something that any of our researchers heard about in their work?
It wasn't something looked at in the quantitative strands of the research, but it is something that could be looked at using the rich linked data that are in the IDI. As Jonathan said, there's just an incredible range of possibilities to explore these deeper questions.
Yeah, we do have plenty of linkable data, but I don't think it would get as far as measuring the actual cost. We might be able to find the uptake of services. But what does it say if disabled people don't uptake services as much as non-disabled people in this space? It doesn't mean that disabled people are less likely to be involved in violence of a domestic kind or otherwise. It might mean they're just not getting to the services they need. So I think we've got to look out for what we're asking for and why, and not just assume that what we can see in administrative data is actually answering the right questions. So I would have some caution. I would want to be talking with experts in the domestic violence space and pointing to what it is we need to be asking and whether the IDI is going to deliver, or whether we actually have to go and do something else completely different by way of survey, getting specialist outside researchers to do some other work.
Thank Thank you for that, Jonathan. Great points. Just wondering on the qualitative side of things, if there was things that were heard in that, maybe Rebecca or Helena.
We didn't speak a lot about domestic violence. We did speak a fair bit about relationships breaking up, particularly parents, and particularly impacting the mothers. There's been a change recently, actually, that to do with child support and benefit eligibility, which had previously been quite detrimental to the mothers who were living with disabled children after their partners had left. One thing that people were concerned about was that whole thing about if you move in with your partner, being deemed financially dependent on them can be a pretty risky situation for people. Yeah, that was just a general concern raised. I just realised I answered a question in the chat, and I was wondering if I could just quickly shout out to that question verbally. Is that cool?
Sure. Go ahead.
Andy asked about the expensive items and services. There's extra costs around predictability, because when you might not be well enough to use something next month or the month after, it's hard to commit to a subscription or something which would actually save you money in the long term. And I just wanted to say, yeah, absolutely, that did come up a fair bit. It's quite hard committing what to spend limited resources on when you're then not sure if you're going to be well enough or, you know, have enough money in your wallet to actually enjoy it properly. That is quite a hard thing. Yeah.
Thank you. Helena, did you have anything to add on the topic of family violence, sexual violence?
Nothing that comes to my mind. Is there anything that comes to your mind, Fee?
I know that, our protocol, we were very aware that we might encounter people who were living with domestic violence. And as we sat around people's dining tables, people shared the stories. We had a small sample, so again, a smaller sample around violence, of leaving partners, of interactions with partners over children and decisions about where children would live in terms of the benefit that went with tangata whaikaha, tamariki, rangatahi. And so we collected a little bit of information, but I think it needs to be more around this. It needs to be connected with some of the research that MSD is doing generally about elder abuse, issues around enduring power of attorney, and actually just recognised as something that just threads through people's lives, often in very unexpected ways. And if you're not going to ask about it, people probably won't tell you. So I think that awareness and just the sensitivity and the openness to hearing those stories was really important for us.
Kia ora. Thank you for that.
Yeah, Prudence, before you go on, can I just add, Ministry of Justice has done some work into crime and victims survey analysis and disaggregating by disability status, but I'm not sure that necessarily people get what they want with respect to family violence, sexual violence out of that exercise. So, if people out there believe that the available analysis that's in the public domain is not good enough, then sharing the why isn't it good enough would help those of us who are trying to push the data analysis agenda along. If agencies aren't doing the right things by data and evidence for disabled people, then we have a duty to ask our communities what isn't happening to the right level. Please tell us how we can change it.
Thank you. Now, we've talked a lot about policy and practice, but we had a question around what legislative changes are needed.
Maybe I'll start. The things that bind caseworkers at work and income that are courtesy of hardwired things in the social security legislation are certainly things that would have to be undone by way of new legislation. But there is plenty that can happen without legislative change that should be happening as soon as an agency is aware they need to change the way they do things, those practice points we talked about before. And there are plenty of things that can be done in regulation as against going the whole hog of legislation. But yes, there are definitely things that would have to change in legislation because, for example, receiving benefit in any form of support that is in social security legislation automatically starts to look at the other income people have, the assets they own, and all sorts of things like that. And marital status or relationships somewhat akin to marriage status is all hard-baked. And if we want to see fair treatment of people as individuals, we have to change the legislation, that's for sure.
Thanks, Jonathan. Any other thoughts about what legislative changes are needed?
I really like what you said, Jonathan. I think the partnering part of the legislation needs to change so that people can be independent in their own right. Across our research with young Māori mums, with tangata whakaha Māori, this issue of partnering and the loss of independence is huge and leads people to live secretly with others, which is very stressful. And I think I did pick on case managers, but the case management practice is in policy, is in legislation, and that hardwiring needs to change. And I also think, and it's been raised in the questions, that differential between ACC payments and work and income payments. The dilemma that I was told by Ministry of Social Development was not going to be examined, but I think that at some point we have to face the reality that people with similar or even comparable economic hardship are in different situations, or potential economic hardship are in different situations because they access different funding streams through ACC and work and income.
Thank you for that. On to our last question for panelists, and that question is, did your research show whether there is a difference in the hardship experienced between people with disabilities who are on benefits and those people with disabilities who are 65 plus on superannuation? Is there anything that you heard during the research or that perhaps links to that question that any of our panelists could share?
Our sample was primarily under 65 age, so not so much, but maybe the quant did.
There are some findings which are all from the perspective of child material hardship that look at hardship rates depending on whether the children are living with older adults or with working age adults. From memory, been a long time. I think the hardship rates were lower when the disabled person was an older person, which possibly speaks to the more stable and generous income that New Zealand superannuation provides.
Yeah, further to that, I think the question's great. We can do that. But the more we slice and dice households and try and make them different, and by definition, a household with an older disabled person as against a younger, we run into the groups being too small. So it was more effective in what we've done thus far to lump groups together at similar income levels, not worrying about where that income comes from. But, if we really want to know what the experiences are for households that have people receiving superannuation, it is quite easily achieved at that big data level. Absolutely. But someone's got to want to ask the question, and someone's got to want to pay for the research to get the answers. And the people who are in the best positions to ask and get the answers are called ministers of the Crown, not of the Church.
Indeed. Thank you, Jonathan. What we've heard this morning really adds weight to what the data has shown for some time now, and that is the really unfair and significant hardship that too many tangata whaikaha Māori and disabled people are living with. This research is very personal, and we don't find it easy to talk about our financial situations or dissect our lives into costs or challenges, but people respond to surveys or participate in research usually because they want to see action to improve things. And we know many of you who are here today have been working to improve disabled people's lives, and we hope today's session with our wonderful panel has helped break down the research in ways that make it easier to use in your ongoing work and to keep looking at it and what it shows. We all have the right to a decent standard of living as disabled people, and we all want to get on with our lives. We want our leadership recognised, but this fight to enjoy our rights is not ours alone. So we need to see all of us act with our places of influence to advance everyone's right to have a decent standard of living and to fairness for tangata whaikaha Māori, tangata malo, and all disabled people to enjoy that right equally on an equal basis as others.